Hello and welcome to our 2021 UC San Diego Open Enrollment Retiree presentation. My name is Deborah Wells and I'll be highlighting some of the benefit options and changes for next year. For a full and detailed presentation, please log on to our open enrollment dedicated website, ucal.us/OE. There you will find UC's virtual benefits fair, information, and presentations. Open enrollment booklets will be mailed the week of October 23rd. UC used the address you had on file as of October 2nd, 2020. The booklet you will receive depends on if you are actively working or retired. Active faculty and staff, you will receive the booklet on your left. For retirees, you will receive the booklet in the middle. Retirees living in a state outside of California and all family members are enrolled in Medicare, you will receive the booklet on your right. When a UCSD retiree receives their open enrollment booklet, they should make note of the number listed above their name. If it says 100, the rates listed in the booklet apply to you. In this example, this retiree has 85 and is subject to graduated eligibility. This means UC will pay 85% of the UC contribution toward their medical and dental plan. This retiree would need to log into UC Raise to find out what their premium will be for next year. There are many important decisions to consider during open enrollment. If you previously suspended your benefits, this is your opportunity to re-enroll. Things to consider during open enrollment would be, are you satisfied with your current medical plan and dental plan provider options? Have you recently married or added a new family member? Are you aging into Medicare next year? Have your health needs changed and do you need more flexibility? Do you need to add or remove any dependents? Change your medical or dental plan? Or enroll in the VSP or ROG legal plan? So what happens if you do nothing? If you are satisfied with your current health plan options and do not need to make any open enrollment changes, your current plan selections will automatically continue for next year. Tools you can use. There are many useful tools available to help you with your open enrollment decision. All retirees receive an open enrollment booklet every year. When you receive your booklet, make sure you read it cover to cover. If you have not received your booklet by November 1st, contact RAS to make sure we have your current address on file. You should also log on to UCNet to access online tools and resources to help you with your open enrollment decision. To access this information, go to ucal.us/OE and click on Retirees. Then click on UC Raise. By logging on to UC Raise, you will be able to review your plan premiums and make open enrollment changes. For retirees or family members that are not eligible for Medicare, make sure you access the Which Medical Plan is Right for You. You can find this medical plan comparison online. For retirees or family members that are enrolled and eligible for Medicare, make sure you review the Which Medicare Plan is Right for You. Again, you can find this Medicare plan comparison online. Available plans next year are the same as this year. There are no new plan offerings. Anthem Blue Cross will continue to administer our UC Care, Core, and UC Health Savings Plan. The UC Health Savings Plan is not open for enrollment, but current members can continue their enrollment next year. HealthNet will administer our UC Blue and Gold plan, and we have Kaiser Permanente. Our Medicare retirees, Anthem Blue Cross will continue to administer our UC Medicare PPO plan and UC Medicare PPO with no drug coverage, and our UC High Option plan. High Option members, to enroll in this plan, all members must be enrolled in Medicare Part A and Part B. We have Kaiser Senior Advantage. United Healthcare will continue to administer our UC Medicare Choice PPO plan, and then VIA Benefits for our retirees living in a state outside of California. Our other plan offerings are Delta Dental PPO, Delta Care USA, VSP, ROG Legal Plan, and Prudential Life AD&D. Nationwide will continue to administer our pet insurance plan. Your medical and dental plan options depend on where you live. If you live in California, your medical plan options are listed on the left. If you're a retiree living in a state outside of California, your medical plan options are listed in the middle. If you are a retiree living abroad, your plan options are listed on the right. If you are a retiree that will become eligible for Medicare within the next year, it is very important for you to know what UC requires of you when it comes to Medicare. Everything you need to know can be found in the Medicare fact sheet available on UCNet. Most people become eligible for Medicare at the age of 65. There are some individuals who qualify for Medicare under the age of 65 due to a disability. That's determined by Social Security. If you do, contact RASC or your healthcare facilitator for instructions. Retirees and their family members who are enrolled in a UC-sponsored medical plan and become eligible for Medicare Part A for free, you are required to enroll and pay for Medicare Part B. UC relies on Medicare to offset the cost of medical insurance. Failure to comply may result in penalties and loss of UC-sponsored medical coverage. There are exceptions. Those who retired prior to July 1, 1991, and retirees who live outside of the United States. But keep in mind, when and if you return to the United States, you may be subject to Medicare late enrollment penalties if you did not keep your Medicare premiums current. If you did not pay into Social Security nor earn 40 credits elsewhere, you are still required to apply for Medicare and show proof to UC that you do not qualify. Although you do not qualify under your own work record, if you are currently married at least 1 year, you may qualify under your current spouse if they are eligible for Social Security. That's usually at the age of 62. If your spouse is not yet age 62, make sure you reapply when they do age 62. Many of our retirees don't remember this and they don't apply until their spouse age 65, and now they're 3 years late. And there's nothing the university can do when you have a penalty to pay. If you're currently single but was previously married at least 10 years, you may qualify under your former spouse if they are eligible for Social Security. It is very important for you to know the facts about Medicare and what UC requires of you so that you are not penalized later. Medicare premiums. When it comes to Medicare Part A, most earn Part A for free. When it comes to Medicare Part B, premiums are based on your modified adjusted gross income. Those with higher income will also have to pay for Medicare Part D. When it's time for you to apply for Medicare, you will need to contact Social Security. You can apply online at ssa.gov or by calling Social Security directly. If you are collecting Social Security, your premiums will be deducted from your Social Security check. If you decide to delay your Social Security income benefits, you will need to contact Social Security to make payment arrangements to pay your premiums. For those who become eligible for Medicare this year, Social Security based your premium on your 2018 earnings. Social Security will base your premium on your income from 2 years prior. So for next year in 2021, Social Security will look at your 2019 earnings. You can ask Social Security to adjust your premium if you experienced a life-changing event that caused significant income reduction or financial disruption. When you or a family member become eligible for Medicare and there are other family members who are not eligible for Medicare, this is called split or mixed family. As the retiree, you select the medical plan. The plan you choose will determine the plan for your family members. If you are not eligible for Medicare and you enroll in UC Blue and Gold, your Medicare family members will be enrolled in UC Medicare Choice PPO. Or if you are eligible for Medicare and you enroll in Kaiser Senior Advantage, your non-Medicare family members will be enrolled in Kaiser Permanente. If enrolled in the Core or UC Care plan, your Medicare family members will be enrolled in UC Medicare PPO. If you are enrolled in the UC Health Savings Plan, if you or any family member becomes eligible for Medicare, you must complete the UBIN 100 form and enroll in another plan offered above. Please keep in mind, you will also need to complete the prescription drug form based on the plan you choose. 2021 medical plan changes. Let's take a look at UC Blue and Gold. I've highlighted in red the changes. The inpatient copay will remain the same at $250. Outpatient surgery remains at $100. The ER copay is increasing from $75 to $125. The prescription drug coverage remains the same. $5 generic, $25 for brand, and $40 for non-formulary. That's for a 30-day supply. Mail order will remain at $10, $50, or $80 for a 90-day supply. Specialty drugs or injectables will remain at $25 or $50. There is a change. The prescription drug advance refills is changing from a 7-day to 5 days in advance for specialty drugs effective 1/1/2021. Retail and mail order will be phased in. Next year, retail will go from 7 days in advance to 5 days in advance. And mail order, you can order 16 days in advance. For office visits, it remains at $20. Hearing aids remains at 50% up to $2,000. Acupuncture and chiropractic services remains at $20 for 24 visits per year. Telehealth services, there is a change in the vendor. The copay remains at $20, but we will no longer use Teladoc. We'll be changing to Babylon. For the physician medical group, you will still be able to access UC San Diego Health as your provider. Also included is Sharp Community, Mid-County, Greater Tri-City, Vantage, Rady, and many more. There is a change with Sharp-Steely. If you currently have Sharp-Steely as your medical group, you will be grandfathered in, but it will be closed to new members as of January 1st, 2021. The annual out-of-pocket maximum remains at $1,000 for individuals and $3,000 for families 3 or more. What's changing in the out-of-pocket maximum are the copays for hearing aids and infertility services. These copays will not be included in the out-of-pocket maximum. Now, when a retiree is enrolled in UC Blue and Gold and becomes eligible for Medicare, they must complete the UBIN 121 form and return it to RASC. Then that retiree or family member will be enrolled in the UC Medicare Choice PPO plan. I've highlighted in blue the difference between the two plans. For the most part, many of the copays remain the same. Inpatient is the same at $250. Outpatient surgery remains at $100. There is an ER copay change. It'll go from $125 to $65. Prescription drug coverage is the same. Office visits the same. The hearing aid allowance, you have a $2,000 allowance every 3 years, no hearing aid quantity limit. Acupuncture services, $20 for 24 visits per year. The telehealth services, instead of Babylon, you would use Amwell or Doctors on Demand. There's a difference with the physician group. You're not assigned a medical group. You have open access. You may see any Medicare provider as long as they will bill your United Healthcare plan. The out-of-pocket maximum is $1,500 per member for medical and $2,000 for prescription per member. On this slide, I'm highlighting some of the changes for Kaiser and Kaiser Senior Advantage. Let's go over the Kaiser plan first. The inpatient copay remains at $250. ER is increasing from $75 to $125. The prescription drug copays remain the same. $5 for generic, $25 for brand for a 30-day supply. For a 31 to 60-day supply, generic is 10, brand is 50. Mail order, 31 to 100-day supply is $10 or 50. The 61 to 100-day supply is $15 for generic and $75 for brand. There is also a change to the outpatient prescription drug coverage with an exclusion of drugs with an over-the-counter equivalent. This includes drugs with the same active ingredient, strength, and dosage as a prescription drug. It excludes and doesn't apply to insulin or preventive drugs like tobacco cessation and contraceptives. For eyeglasses, it's not covered under Kaiser. Behavioral health, you have two benefits. You have Kaiser Behavioral Health and you have Optum Behavioral Health. Kaiser remains at $20 for individuals and $10 for group visits. When you have Optum and access Optum providers, visits 1 through 3, no copay. Visits 4 or more, $20 copay. For Kaiser members, if you access Kaiser Behavioral Health, please remember if they prescribe you a medication to take your prescription to a Kaiser pharmacy. Hearing aids, you get a $1,000 allowance. You pay any amount in excess of this amount. Acupuncture services, $15 for 24 visits, and it's combined with chiropractic services. And for chiropractic care, $15, 24 visits combined with acupuncture. The out-of-pocket maximum remains the same, $1,500 individual and $3,000 for 2 people or more. The out-of-pocket maximum includes medical, behavioral health, and prescription drugs. When you age into Medicare, your copay will be the same, inpatient $250, ER will go from $125 to $65. Prescription drugs are the same. For Kaiser Senior Advantage member, you do have eyeglass benefits. You will receive a $150 allowance for eyeglass lens, contact lens, and frames every 24 months. For behavioral health services, Optum goes away. No Optum coverage, but you do have Kaiser Behavioral Health, $20 for individual, $10 for group visits. For hearing aids, your benefit increases. You get $2,500 allowance per ear, $2,500 per ear. Acupuncture services, $20 covered as medically necessary. Chiropractic services, $20 when covered by Medicare. Annual out-of-pocket maximum, $1,500 for medical per member. Prescription drug out-of-pocket maximum is increasing from $6,350 to $6,550 per member. Whether you're Kaiser or Kaiser Senior Advantage, all Kaiser members have access to Target Clinic. No authorization necessary. Preventive services are no copay. Non-emergency services, $20 copay. For Kaiser Senior Advantage members, it's good news. For Kaiser Senior Advantage members or members living in the Fallbrook or Kern County area, these zip codes are available now for you. So 92003, 92028, 92059, 92060, 92061, 92086, 92088, and Kern County 93249. If you live in these zip codes, you can now choose Kaiser Senior Advantage. On this slide, I'm highlighting some of the changes for our UC Care plan. This is a non-Medicare PPO plan. As you know, UC Care consists of 3 tiers. Your out-of-pocket cost depends on where you have services rendered. The Tier 1 includes all UC Select providers: UC San Diego Health, UCLA, UC Irvine, UC San Francisco, or UC Davis, any UC provider. Our Tier 2 includes all Anthem preferred providers. This means they have a contract with Anthem Blue Cross. Tier 3 is out-of-network, meaning your provider does not have a contract with Anthem Blue Cross. So let's first go over UC Select. There's no deductible when you access a UC provider. Office visits, $20. Preventive, 0 copay. Inpatient, $250 copay. ER copay is changing from $200 to $300. This ER copay is actually across the board. It's increasing by $100. Urgent care, $20. Prescription drug remains the same at $5 for generic, $25 for brand, or $40 for non-formulary. Mail order remains at $10, $50, or $80. Out-of-pocket maximum is increasing across the board by $1,000. $5,100 to $6,100 for individual, from $8,700 to $9,700 for family for the UC Select tier. For our in-network, the deductible is increasing by $250. It's going from $250 to $500 and $750 to $1,000 for 3 or more family members. The physician office visit is increasing from 20% to 30%. Preventive care remains at a zero copay and not subject to the deductible. Inpatient services increasing from 20% to 30%. Again, ER copay from $200 to $300. Urgent care is actually decreasing from $30 to $20. Services will increase from 20% to 30% for office visits, inpatient and outpatient services when services are obtained within the United States. Tier 2 prescription is the same as Tier 1. The out-of-pocket maximum is increasing from $6,600 to $7,600 and $13,200 to $14,200 for family. The out-of-network, the deductible, again, is increasing by $250 from $500 to $750 for individuals and $1,500 to $1,750 for family members. When you access out-of-network non-contracted providers, you will pay 50%, and keep in mind that provider can bill you for the balance. The ER copay, again, from $200 to $300 in the out-of-network tier. Prescription drugs, retail and specialty, you will pay 50% for those prescriptions for a 30-day supply. Prescriptions for 31 to 90-day supply, mail order is not covered. Out-of-pocket maximum is increasing from $8,600 to $9,600, and family out-of-pocket maximum from $19,200 to $20,200. For UC Care members, another change is the Anthem's mobile app pricing tool. The Anthem Engage Elite Plus is being terminated. It will not be available. Another thing I like to mention for UC Select Tier 1, I want you to make sure that you review the evidence of coverage booklets for limitations, exclusions, and services that are not available in the UC Select tier. And sometimes multiple co-payments can apply per service. The UC Health Savings Plan has a few updates as well. As mentioned before, this plan is not open for enrollment, but if you had this plan while you were still working and an active employee, you can continue your enrollment into retirement. The changes are to the individual health savings account contribution. For individuals, it's increasing from $3,550 to $3,600. For family, it's increasing from $7,100 to $7,200. For those age 55 or older, the $1,000 catch-up contribution remains the same. Termination of the Anthem Engage Elite Plus mobile app. Again, it's not going to be available next year. If you or a family member become eligible for Medicare, you must complete the UBEN 100 form to enroll in another medical plan. The family member that's aging into Medicare must also complete the corresponding prescription drug form. The core medical plan is a non-Medicare PPO plan with worldwide coverage. The calendar year deductible remains the same at $3,000. Preventive services is no copay and not subject to the deductible. For other services, you pay 20%, the plan pays 80%. There is a change between an in-network and out-of-network tier when it comes to prescription drugs, and that's for amounts of 31 to a 90-day supply. It's not covered. There's no hearing aid benefit under core. The out-of-pocket maximum remains the same at $6,350 for individual and $12,700 for a family. Remember, if you use out-of-network providers, you could be balance billed. Again, the Anthem mobile app, the Anthem Engage Elite Plus is being terminated. The UC Medicare PPO has very few changes. In this plan, Medicare is primary and they pay 80% of the allowable amount and send the balance to your supplement plan, Anthem Blue Cross. And then Anthem Blue Cross pays 80% of that 20%, and then the balance is your portion to pay. The calendar year deductible remains the same at $100. Inpatient services, days 1 through 60, no copay. Days 61 through 90, you pay $70.40 per day. Days 91 or more, you pay 20%. Office visits, 20%. Prescription drugs remain at $10 for generic, $30 for brand, and $45 for non-preferred, non-formulary. Specialty drugs remain at $30 for generic. When it comes to a 90-day supply, generic is $20, preferred $60, non-preferred or non-formulary $90, and specialty drugs $60. For eyeglasses, there's no coverage. UC Medicare PPO plan members should consider enrolling in VSP. Hearing aids. Hearing aids are not covered by Medicare, but Anthem does have coverage. They pay 80%, you pay 20%. Acupuncture services, again, not covered by Medicare, but Anthem does cover it. At 80%, you pay 20%, up to 24 visits per calendar year. The annual out-of-pocket maximum remains the same at $1,500 for medical per member. The prescription out-of-pocket maximum is increasing from $6,350 to $6,550 per member. For telehealth services, Live Health Online will continue to administer our telehealth services. For doctors and psychiatrist visits, there's a $20 copay. This plan offers worldwide coverage up to 6 months. If you plan to travel over 6 months, you must contact RAS to enroll in UC Care or CORE. Please remember, you must use Medicare-approved providers. The exceptions are to acupuncture services, hearing aids, and behavioral health outpatient office visits when all licensed providers, including psychiatrists or psychologists, marriage or family therapists, you can access these services. Although they're not covered by Medicare, Anthem Blue Cross will cover these services. For the UC High Option Supplement to Medicare plan, between Medicare and your Anthem Blue Cross supplement plan, most services are covered in full at 100%. The deductible remains at $50. Inpatient services, days 1 through 90, no copay. Days 91 or more, you pay 20%. Office visits, no copay. Behavioral health, you pay nothing when services are provided by Medicare. Otherwise, you pay 20%. Prescription drugs, for a 30-day supply, generic you pay $10, brand $30, non-preferred you pay $45, and specialty drugs you pay $30. For a 90-day supply, you pay $20 for generics, $60 for preferred, $90 for non-preferred or non-formulary, and $60 for specialty drugs. For eyeglasses, there's no coverage. High option members should consider enrolling in VSP. For hearing aids, not covered by Medicare, but Anthem does cover it at 80%, you pay 20%. Acupuncture services, not covered by Medicare, Anthem pays 80%, you pay 20%, up to 24 visits per calendar year. The annual out-of-pocket maximum remains the same at $1,050 for medical per member and $1,000 for prescriptions per member. The troop out-of-pocket maximum is increasing to $6,550 per member. Live Health Online will still administer our telehealth services with the $20 copay. High Option also offers worldwide coverage up to 6 months. Again, if you travel or will be living abroad over the 6-month period, you must contact RAS to enroll in UC Care or CORE. Again, you must use Medicare approved providers, with the exception of acupuncture, hearing aids, outpatient office visits with licensed behavioral health providers, including psychiatrists, psychologists, marriage and family and child therapists or counselors. If you change medical plans next year and you or a family member is currently receiving ongoing medical or behavioral health treatment, please contact your new medical plan directly to request assistance with transitioning your care. The numbers to contact your plan are listed here, but it's also listed in your open enrollment booklet. Via benefits. Since 2014, UC began offering retirees who live in a state outside of California their medical plan coverage through UC's Medicare Coordinating Program. Remember, all family members must be enrolled in Medicare. This plan program offers more choice, value, flexibility, and support. UC will provide an annual contribution for each covered family member under a health reimbursement account. Each covered family member will choose an individual plan that's best for them. Use your health reimbursement account funds to pay for Medicare supplement plan, Medicare Part B or Part D premiums, as well as additional out-of-pocket costs. Remember to look on your open enrollment booklet for the number listed above your name. That will determine what your contribution will be for the year. During open enrollment, VIA benefits members must use a paper form to enroll or change their dental, vision, or legal plan. 2021 non-medical plans. Delta Dental PPO remains as our PPO provider and offers worldwide coverage. There is a change with crown and prosthodontic replacement. Currently, you receive these services once every 5 years. Starting next year, you will receive these services once every 7 years. Covered exams, you currently receive 4 exams per year. Starting next year, you will receive 2 exams per year. Delta Care USA for California residents only. There is a correction. Crown Fusion copay correction. Currently, it's listed at $50 when it should have been $150. So all we're doing is correcting the copay for next year. Remember to look at the number above your name to know if you're going to have a premium to pay or not. VSP continues as the vendor for next year for our vision benefits. There is a network change. This year we have VSP Choice. Next year we have VSP Advantage. From Choice to Advantage, there is minimal disruption. There was a 95% provider match. The premium is decreasing for retirees, an average of 15%. If you are not enrolled and wish to enroll for next year, retirees must contact VSP directly. You can go online to vsp.com/go/UC retirees to enroll online, or you can call VSP directly at 866-240-8344. UC San Diego Shiley Eye Institute will accept our VSP Advantage plan, and Walmart Vision Centers will also be added. I realize you have many choices when it comes to selecting a provider for your vision services. The UC San Diego Shiley Eye Institute will accept our new vision plan next year. So if you are enrolled in our vision plan, consider UC San Diego Shiley Eye Institute for your vision services. ARA continues as our vendor for our legal plan. There's no premium change. There is a benefit change. New diversity and inclusion services are being added to support the needs of our UC's diverse population. This includes domestic partnership agreements, funeral directives, hospital visitation rights, gender identifier changes on government-issued documents. Prudential Life continues as our vendor for our AD&D life insurance. No change in premium, no benefit changes. To enroll, call 1-800-524-0542 or log on to UCNet to download the form. Remember, Prudential Life AD&D is always open throughout the entire year for enrollment. Nationwide continues as our vendor for our pet insurance plan. Exclusive plan with preferred pricing just for UC. Coverage for cats, dogs, birds, small mammal, and exotic pets. Livestock and horses are excluded. The rates are based on the species of animal and the state of residence. There's no UC contribution. It's 100% retiree paid through direct bill. To enroll, log on to petinsurance.com/UC or call 877-738-7874. UC Raise stands for UC Retirement at Your Service. Your UC Raise online account make it easy for you to review and make open enrollment changes and confirm your choices online. You can also update your contact information, assign beneficiaries, update your tax withholdings, and much more. If you do not have a UC Raise account, log on to retirement@yourservice.ucop.edu to register and create your account. If you are unable to log in, please call RASC at 1-800-888-8267. Press 1 for locked out of UC Raise account and leave a voicemail. A representative will return your call as soon as possible. When you're ready to view and make your open enrollment changes, first log on to ucnet.universityofcalifornia.edu. Then click on Retiree. Then click on UC Raise. Once you have logged in, you will see your name here. Look for Open Enrollment here. Select your plan options, review your premiums. You can add any eligible family members or remove any family members. And then when you're done, make sure you confirm your changes and you receive a confirmation. If you're unable to make your changes on UC Raise, or if you are currently locked out of UC Raise, call RASC 1-800-888-8267 before open enrollment ends. Paper forms is not the preferred method, but an option for those who cannot enroll online. You would need to complete the UBIN 100 form to change your plan, and it must be received by fax before the deadline. If mailing your form, it must be postmarked before the deadline. If you are eligible for Medicare and you change plans, or you are enrolling in a Medicare plan for the first time, you must also complete the required prescription drug form. The drug form you would need to complete depends on the plan that you choose. Open enrollment ends on November 24th, 2020 at 5:00 p.m. As a reminder, if you experience a qualifying event outside of open enrollment, please contact RASC within 31 days of your qualifying event. So if you move out of your planned service area, your family member experiences an involuntary loss of coverage, marriage, or you add a family member, you don't have to wait for open enrollment, but you do need to add that family member within 31 days of the qualifying event. 2021 Plan ID cards. You may not think about your health insurance ID card until you or your doctor or your provider ask you for information. The appropriate ID card must be presented to obtain benefits for services. Every year, you should make it a point to find out if your plan will be issuing new ID cards. Over the years, I have found that many retirees and employees are carrying the wrong health plan ID card or no ID card at all. You can prevent being denied services by simply presenting the most updated ID card to your provider. All ID cards should be received by the first of the year. If you have not received your ID card by January 1st, please contact the plan directly. Presentations and help desk. If you haven't already attended the virtual open enrollment fair, you need to make it a priority and attend. It's offered 24 hours a day, 7 days a week for the entire open enrollment period. Remember, this presentation is only highlighting some of the plan changes. You will need to review the evidence of coverage booklets for detailed information, limitations, exclusions to your plan, and go over the prescription drug formulary to see if there's a medication change. You can also contact the plan directly for this information. If you attend a virtual presentation and still have questions or need help making open enrollment changes, please join us on November 17th or November 19th, where we will offer open enrollment help desk via Zoom. This will be your opportunity to ask questions to get the help you need. Listed on this page are resources you may find helpful. I've included the steps retirees should use when you are ready to review your open enrollment information. Everything you need to know about your UC health and welfare benefits can be found on UCNet. The evidence of coverage booklets, the fact sheets can also be found here. If you need to contact RASC, I've listed their information here. To contact me, Deborah Wells, or my assistant, Ranisha Martin, I've included our information here. Please keep in mind, there are only 2 of us, and we assist over 30,000 employees and retirees, so there may be delays when you contact us. If you're a retiree and not currently a member of the Retirement Association, I would highly recommend you become a member. The Retirement Association is how you can stay connected to the university and stay up to date with your UC San Diego community. They offer members a wide variety of programs and services. I cannot say enough about how you would enjoy and benefit from becoming a member. Contact Suzanne Shafi, the director of the Retirement Association. I have also listed CMS, Social Security, and HICAP. When it comes to Medicare and Social Security benefits and information, these are the experts to address your questions. I would also like to tell you briefly about our healthcare facilitator program. We assist UC San Diego employees and retirees. We serve a large population of active and retired faculty and staff. You can find our information here and on UCNet. Because we serve so many individuals, there are a few things that you should do before you contact your healthcare facilitator. Take time to understand your benefits. Log into UCNet and review the evidence of coverage booklets and check if there are any limitations or exclusions to your plan. Call your medical plan. Your plan can answer questions about your coverage, authorization requirements, and provider networks, and also help you with your primary care physician. Contact your medical plan or the billing office if you receive a bill. Call your provider to make sure they have billed your insurance properly. As a UC San Diego employee, I take pride in sharing that we were ranked the #1 health system in San Diego by US News and World Report. During open enrollment, if you would like to have access to UC San Diego Health by enrolling in UC Blue and Gold or any of our UC-sponsored PPO plans, you will have access to our UC San Diego Health primary care physicians and our specialists. This also includes the UC San Diego Moores Cancer Center, and the Shiley Eye Institute. UC San Diego Health also offers express care and urgent care services throughout San Diego County. To find a UC San Diego Health provider, call 1-800-926-8273. Finally, I would like to remind you to read your open enrollment booklet, attend the virtual presentations by visiting ucal.us/OE for dates and details, confirm your changes, and make sure you receive a confirmation. If you are satisfied with your current health plan options, you are not required to do anything, but it's highly suggested that you log in to view your current enrollments. If you add a family member, expect a letter from Unify HR in February requesting documentation to verify the eligibility of your new dependent. If you change plans, look for your new ID card in the mail and file your old card in a safe place. Again, open enrollment ends Tuesday, November 24th at 5 p.m. Pacific Standard Time, and this is a firm deadline. Again, my name is Deborah Wells, your UC San Diego Healthcare Facilitator, and I want to thank you for attending the 2021 UC San Diego Retiree Open Enrollment presentation.